why did it take so long for the information to come to light? And if you take the example of the HICRA investigation, which brought out the information, if it is as hands-on as you suggest, then how do we allow a situation to evolve where there was a piecemeal approach almost taken, and suddenly we're in the middle of a crisis which does nobody any good?
Answer that. What I was speaking about was the actual service level arrangement, which is the governance document itself between the HSE and the agencies. In 2009, the Secretary General at that point in time of the Department of Health and Children asked that we would write to each of the agencies and ask what salary scales their senior management were on. So we commenced that exercise in 2009, which is when the CRC piece came to light regarding that scale that was going on. We then further carried out an internal audit, and that process has been ongoing in terms of gathering that information. The public pay policy, as it currently stands at this point in time, has only recently been concluded over the past 2 years. So it's not that we had a comprehensive public pay policy by which to set a barometer with. We did set down that they need to comply with the consolidated pay scales in the service level arrangement in 2010. So we've been gathering that information since 2009. We've put in our internal audit. Our internal audit carried out a review and report. We have that available as well. So it's been ongoing in relation to it. In fact, 47 of those arrangements have ceased, and the important piece is that there's no new arrangements that are being put in place now to pay people more than they should be under the consolidated pay scales. That's very important. And then, as well as another enhancement of that governance, it is the boards who are the ultimate governors of these organisations in the disability sector, or indeed in the hospitals. And we now have an arrangement in place with the boards and the boards chairs, whereby they have to sign off on a compliance statement saying that they are in compliance with regard to the 8 key areas, one of them being public pay policy, government pay policy, and consolidated pay scales. Other key areas that you'd be interested in as well is, the whole area of governance, procurement, taxation. So we've set those out as part of. So it's a continuous process, and that's reality with regard to governance. Governance is on a continuous improvement trajectory right throughout the country.
Mr. Bryan, you said it in your remarks about the non-standardised approach, and then you said prior to the HSE coming into being. Yeah. But can I make the point to you that prior to HSE coming into being, you had the health boards who were the agents of the state, and who's culpable of that, allowing that non-standardised approach? Because, like Deputy Aquila, if it's only 47 out of 143 have ceased, and the Internal Audit Review Committee have said all should be gone, I mean, I would take the point, and I appreciate where you're coming from, but doesn't that make a mockery of the whole process then, whereby your hands are tied effectively by saying that if I pursue person X or organisation Y, it will cost us in the courts and we may lose, so the whole process is really just a cod?
Well, I think, to be fair, Chair, if you look at what has emerged from the internal audit report, if you look at the 22 recommendations, huge progress has been made in giving reassurance to the taxpayer as to compliance with public pay policy. All I can say, and it emerged from the internal audit report, was that prior to 2005, many of the Section 38s would have dealt directly with the department, and on that basis, there was varying arrangements. And all I'm saying, by
the department.
Well, no, I'm not saying by the department. I'm saying quite clearly there was varying non-standard arrangements, and the challenge for us was bring standardisation. Okay. And all I can say is that I think in the last 18 months, the level of work and dedication to achieving this, and I think, Chair, there'll be a certain appreciation of the having regard for the rights of each and every one individual, So in some senses, huge progress has been made. We're nearly completed. But I think you'll have to make an analysis when we're finished, whether what we've achieved, there was always going to be the potential for red circling, and even that's allowed for in government pay policy. Okay. They recognise that there was the potential for this, and therefore they've put it in the policy.
Sure, and I would appreciate the role you've played, to be fair. I mean, you have played a significant role, and I appreciate it. Money, if your financial system is not fit for purpose
Well,
and is, if you like, antiquated, and you have 11 different
Yes.
models of delivery of the service, aren't you doing a disservice to yourselves and to the people by not having, and when do you expect Deeper to come back to you with a reply, or will we have another PPAR saga, or what's going to be the situation?
we very fundamentally recognise our requirement for new financial systems, and our requirement for it has been specified on a number of occasions. The period of time that we expect Deeper to come back on is very soon. It's gone over for approval to them. It's been approved by the Department of Health. It's a very significant specification which we have for the financial systems. You're correct, Chairman, with regard to the PPAR system and the whole debacle that ensued. And in fact, it is important to say that the PPAR system itself is a very effective system. It's one of our better HR systems. Our financial data, while you're saying it's not integrated, it's not. We do consolidate it, though, to provide financial information. What we don't have, though, is the level of at-your-desk ability to do costings, you know, at a very granular level, which actually would make the job of the accountants and indeed those of decision makers who require that information far easier. So we very significantly require an integrated system, and that's with Deeper for approval, and it's been in gestation for a long period of time. So we welcome. We'll welcome it.
What's a long period of time? Is that fair to ask?
Well, we had looked at, previously there was a financial, it's not with Deeper, that period of time, but there was a system as well as PPARS, there was a financial information system being looked at the same time, which is around the year 2006. And because of the PPARS issue as well, that was stepped down as well, and there's a whole, correctly so, an approval process put in place in relation to the procurement, but as well the whole project management in relation to the financial systems. But it is a significant system to put in place that we're actually looking for, and it's with the Department of Public Expenditure and Reform for their approval at this point in time. In relation to...
Just asking in terms of the Section 38, in terms of the whole corporate governance, and in your remarks to us, you make reference to the annual compliance statement. And if you were to delve into that, in terms of the engagement, is it by an annual meeting? Is it only one meaningful engagement based on a document every year, which is your annual compliance statement between you and the agencies? And if that's the case, then is this sufficient? Should we have a larger amount of engagement outside of this? And also, given the volume of money, would it not be prudent that there be more regular contact than just once a year?
Maybe, Chairman, if I take that in two parts, if you don't mind. The first protocol is our service level arrangement, which is a very expansive and comprehensive document. So that sets out the full range of services to be provided and the money. That's where the engagement takes place, ongoing, with the manager and the chief executive of the hospital with regard to the money that's been given for the services provided. That's an ongoing. And then every month there's a formal meeting, it could be even more frequently in some organisations, regarding that's the amount of money, where are we with regard to our delivery. So, for example, with the hospitals, that takes place every month regarding where are we with regard to the delivery of the service, the amount of money, budget, etc. So that's ongoing, and that's at a very senior level, right up to ourselves, the National Director, CFO, myself, at those meetings in relation to that. In relation to the compliance statement, so the compliance statement is new, and what the compliance statement, what we were seeking to do was to put in place best practice from a governance point of view. So this is an arrangement with the chairman of the board and another director, so it's an arrangement with the board whereby, as governors, they are signing off to say that they've reviewed everything which is in the service level arrangement, and that they are in compliance with 8 of the key issues which are set out in the service level arrangements. And this is 2 pages. So it deals with procurement, it deals with finance, it deals with governance, risk management, remuneration, taxation and capital assets. And what they're given a declaration is that they have checked everything, because they are the governors of the board, and that they are in compliance. Or if they're not, and you wouldn't expect them to be because it's retrospective at this point in time, if they're not in some of the areas, that they have a plan in place to go in compliance. We've also set out, which hasn't been done previously, in terms of what is good practice in relation to board membership and the various committees that should be set up. So this is with a view to putting in place and harnessing a relationship with the board chairs, and we're meeting with those twice a year, and the Director General is meeting with them as well on one occasion. We've already met with them in June. As part of that, we also have an information exchange for them so that they're aware of what's going on in relation to best practice. We had a speaker the last day, and we were reflecting on the events, obviously, of CRC, lessons learned, and putting in place a framework so we could have a shared learning in that regard.
Given the debacle that is and that was the CRC regarding corporate governance, board membership, failure to fulfil our obligations and duties as a board member, how confident are you now that, and how assertive will you be in ensuring that all your organisations will have this corporate governance, and that they will, when they become a member of a board, sign up to it and know their duties and roles and live up to that responsibility?
Okay, so on that, what we did was, when we issued the compliance statement, we had a meeting in December at which we discussed this new compliance statement that was going in place. We asked, and all of the chairs of the Section 38 agencies came to that meeting. We asked at that point in time that they would signal their intent and confirm in writing that they would be willing to sign up to this process of compliance, that they would sign it on behalf of their agencies. We've got that back in respect of all of the agencies. So they said yes, that they would be. We asked that we'd have a compliance statement returned to us by the 31st of May. And as part of that, we said that an audit they could carry out their own audit in terms of, and their plan in terms of when they would be in compliance in 2014. Almost all of the agencies have completed that at this point in time, and I can give you the status in terms of where exactly we are. I'll just give it to you so I can give it to you directly.
Thank you.
So we have 38 agencies that have submitted it in full. If you just bear with me, I'll just get it here, just get you the full figures. Yes, there's 44 of those Section 38 agencies, so 38 agencies have returned the completed statement. 4 agencies were granted an extension due to date of their board meetings, and because you needed the signed annual financial statements back at the time. A further meeting was held with one agency to deal with very specific issues, and one agency had a different governance structure as part of a university arrangement, and there's different legislation under charter that's required with that. It's one of the dentists. So 36 of the agencies have identified additional requirements and what is required actually to bring them into full compliance, and we have that set up as part of the overall business unit that we have there, with looking at those plans so that by 2014 we certainly would hope to be in a number of those agencies, the majority of those agencies would be in compliance, and at that stage we will have resolved the issue with regard to the pay. It's important as well, though, to put it into context. We all acknowledge the very significant and important services that are provided by these agencies, but as well there's between 30 and 33,000 staff, and of those there's 143 staff that we're looking at. So that's the range, that's the level of staff that are in these agencies. So 143, albeit significant, but still in relativity terms with the number of staff that are in. I'm not minimising it, but just in terms of the extent of it.